I'm Dr. Frita, and today I'm giving you 5 kidney disease warning signs that are hiding in your mouth. What if I told you that your mouth has been trying to warn you about your kidney health? Listen, your kidneys are responsible for filtering 200 liters of blood every day. And when this filtering process breaks down, it can show up all over your body. It can show up in different ways, including in your mouth. I am a board certified kidney and high blood pressure doctor, meaning I take care of patients with kidney disease every single day. And oftentimes, by the time they show up and by the time they develop symptoms, it's already a little far gone. And so that's why I want to let you know every nook and cranny in your body that might be giving you a warning that you could have kidney disease, including the nook and cranny that is your mouth. Taking care of kidney patients is what I do in my real life. I'm not just some wellness internet guru. I'm an MD. I'm a medical doctor. I graduated from Meharry Medical College. I completed a dual internal medicine pediatrics residency at Georgetown University Hospital School of Medicine. And then I completed my nephrology, my kidney fellowship at Emory University Hospital. So today, I'm not just telling you what I've read about. I'm telling you what I know, what I see in my practice. If you want to learn more about your kidney health and how to preserve it using evidence-based medical information, then stick with me because today I'm giving you 5 kidney disease warning signs and symptoms that are hiding in your mouth. Keep watching. Listen, I love talking to you and us having these conversations through my videos, but you know what else I love? Talking to you one-on-one. So if you would like to have a consultation with me one-on-one, I do provide a telehealth concierge service, and I can talk to you from anywhere in the world. We have a conversation, a video call. I do a full history. I give you a first opinion. I give you a second opinion, and we can talk about kidney disease. But remember, yes, I'm a board certified nephrologist, but I've also been board certified in internal medicine, pediatrics, and obesity medicine. And so there's a whole lot of subjects that we can cover, and we can cover them one-on-one from anywhere in the world. It doesn't matter. So please, if you're interested, click the link in my description and let's have a telehealth concierge appointment. I'm Dr. Frita. I am a board certified nephrologist. Yes, I'm a board certified kidney and high blood pressure doctor. And so I want you to be sure to give this video a like and to share it with someone you care about because I'm about to give you evidence-based medical information. So let's get into it. Here are 5 kidney disease warning signs and symptoms that can be hiding in your mouth. Number 1, dry mouth or xerostomia. Now, when I say dry mouth, I just don't mean a mouth that feels a little bit thirsty because you haven't had enough to drink. I'm talking about a mouth that is persistently dry. And even after you've had enough water, you still feel that your mouth is parched and sticky and irritated. Here's the kidney disease connection. When your kidney disease are not filtering toxins properly, those toxins can build up in your body and they can affect the way that your salivary glands produce saliva. If your salivary glands are not producing enough saliva, then of course you can develop a dry mouth. And having a dry mouth has its consequences. Patients with a dry mouth have an increased risk of gum disease, cavities, mouth infections. And so these things might make you show up to your dentist when truth of the matter, the root cause could be a decrease in your kidney function. Kidney disease is not the only thing that can cause you to have a dry mouth. There are other disorders like autoimmune diseases, Sjogren's, even diabetes and high blood pressure can be associated with having a dry mouth. And we know that diabetes is the number 1 cause of kidney disease. High blood pressure is the number 2 cause. Either way, if you are someone who is experiencing a persistently dry mouth, even when you are well hydrated, it is certainly worth calling your doctor and asking to be evaluated for kidney disease. Question: do you have a family member living with diabetes or hypertension? If so, please share this video with them. Their kidneys may already be sending them signals they don't know how to read yet. Warning sign number 2, a metallic or ammonia-like taste in your mouth. Now, this is one that I see quite commonly, and I'm telling you, it shocks my patients with kidney disease every time. When you have kidney disease, specifically advanced kidney disease, where you're really not filtering out the toxins properly, I'm talking about when you've progressed to CKD stage 4 or even CKD stage 5, then you can develop something called uremia. Uremia is a state when you have a high level of certain kidney toxins in your blood. You can look at your my chart and just look at your labs. And if you have a very elevated BUN, or if you have a high creatinine, or if you have a low EGFR, one that is less than 30, and certainly an EGFR that is less than 15, then you could be someone who is experiencing uremia. Here's the issue with uremia. When you have these very high kidney toxins in the body, they are in your blood, meaning they go all over your body, including to your mouth. So if you have uremic toxins in your mouth, they can affect your taste receptors, which will affect how your food tastes, which is why many of my patients who develop uremia will have a metallic-like or an ammonia-like taste in their mouth. They might say that food tastes kind of like pennies, or it has a chemical taste to it, or they may say it's bitter and it just doesn't taste right. Also, when you have advanced kidney disease and uremia, it can affect the way your body metabolizes zinc, and this can also alter the way food tastes. Does any of this sound familiar? Because for patients who have this metallic taste, they can oftentimes have denial. Case in point, I have patients who will come to my office, I'm treating them, and they may have advanced to CKD stage 5, which technically is when you're eligible for either dialysis or some form of kidney or renal replacement therapy, like a transplant. Mind you, just because your numbers have decreased to an EGFR of less than 15, CKD5, that does not mean that you automatically have to be started on dialysis, which is why I monitor my patients. And by the time dialysis or a kidney transplant, by the time these things are indicated, that's when I go ahead and proceed. That's just a little note to yourself. Just because your EGFR is less than 15, your nephrologist does not have to automatically put you on dialysis. Okay, back to the point at hand. When I have patients who progress to the CKD5 level, part of my visit is figuring out, okay, do you need to have renal replacement therapy? Is this the time? And so I'll ask them about how food tastes. And many patients are in denial. They might say, well, I mean, I guess food tastes a little weird, but it's okay. Or a lot of times my patients will start to lose weight by the time they get to CKD stage 5. I'm talking about 20 pounds, 30 pounds in a short period of time. And the reason could be because food doesn't taste right with the uremia. But a patient who's in denial might say, oh, no, it's just a choice. I'm just cutting back on eating because I needed to lose weight. So just listen to what I'm saying. And if you know that you have some form of kidney disease and what I'm saying is resonating with you, just pay attention and talk to your doctor. And the other thing is that you, as a person who has this odd taste, you're sometimes not going to be the only person to notice it. Sometimes it can make your breath actually smell like ammonia, or it can even make your breath smell like urine. And so if you're listening to me and you have a loved one and you notice that they're not eating as much and their breath smells kind of like ammonia or urine, then talk to them. Have them to go to see their doctor, because having a metallic or ammonia-like taste in your mouth or an ammonia or urine-like smell very definitely could be a serious warning sign of kidney disease. Be sure to watch my video on CKD stages explained after you watch this video. Warning sign number 3, pale, discolored, or coated tongue. Now, I want you to check this one right now. Grab your smartphone, put it on photo, and just look at your tongue. Take a picture of it or a video, or go to the mirror and take a look. A normal tongue should be pink or reddish looking, okay? Full of color. If your tongue is pale, or even if it's bluish, this could be a warning sign of kidney disease. Here's the connection. Your kidneys produce a hormone called erythropoietin, and erythropoietin, or EPO, is responsible for stimulating your bone marrow to make red blood cells. If you have CKD, chronic kidney disease, especially if it's an advanced CKD, then you will likely have a decrease in your erythropoietin production, and this can cause you to be anemic. If you are anemic, it could show up as a warning sign in your tongue, and your tongue could look pale, or it can even look bluish, which could be an indication of stasis. Now, other forms outside of just in your tongue can also indicate that you have anemia. If you pull down your bottom lip, take a look at it. You should see all kinds of fine reddish, pinkish vessels, okay? You should be very pink inside of your mouth, like in your gums. If you're pale, if your gums are pale, then that could be another warning sign hiding in your mouth that you have kidney disease that's showing up as anemia due to your kidneys not making erythropoietin. Another warning sign that can show up on your tongue is a coated tongue. If it's very white or yellow, if you literally have like a layer or a coating of your tongue, that could be a sign that you have inflammation. In fact, research shows us that CKD patients with whitish or yellowish tongues, if they have like a thick coating, that has a direct correlation with increased inflammatory markers in the blood. Also, if you have a lot of white on your tongue, a white coating, that could be oral candidiasis or thrush. And when you have thrush, that oftentimes signifies that you have some type of a compromise in your immune system. And we know that patients with advanced kidney disease, especially if it's in CKD5 or patients who are on dialysis, oftentimes those patients also are immunocompromised, and that could lead to having a white tongue from thrush. So if your tongue is pale, if it's coated, if it's bluish, then please make sure you consult with your doctor and find out if you're having any issues with your kidney health. Question: which one of these 5 warning signs surprised you the most? Let me know in the comments, and if any of them sound familiar, please share this video with someone you love. Warning sign number 4, mouth sores and gum problems. Have you been going to your dentist because you're having inflamed gums, or you're getting sores in your mouth, or you're having a lot of bleeding? Well, the issue might be a little beyond just a dental problem. It could be a warning sign that you have kidney disease. So, in patients who have that uremia we talked about, where those uremic toxins, those kidney toxins are building up in your blood, well, those folks can have something called uremic stomatitis. And this is when you can literally get a breakdown of the mucosal lining of your gums, and it can lead to you getting ulcers or erosions in the mouth. This is different than a typical cold sore or a canker sore, and it's something that tends to be repeated. Plus, if you have uremic stomatitis, then you're likely to have some of the other warning signs we talked about, like dry mouth, or you may have some other kidney disease warning signs. Be sure to watch my video on the warning signs and symptoms of kidney disease after you finish watching this video. So here's the kidney connection to the mouth sores and the gum problems. When patients develop uremia, it causes an issue with your platelets. Your platelets are those cells in your blood that are responsible for helping you to clot so that you don't bleed a lot. Patients with uremia have platelets that no longer stick together, and so uremic patients will tend to bleed. And so patients who have gum issues and easily bleeding gums, well, it's possible that you have uremia from kidney disease, and that's why every time you brush, you bleed. Now, there are indeed other things that can cause you to have bleeding gums or gingivitis, but certainly if you're having other warning signs and symptoms as well, it's worth finding out if your bleeding gums are due to kidney disease. The other warning sign that you might see in your mouth if you have advanced kidney disease, well, you might see petechiae, or little fine red dots in your mouth, or even bluish dots, or little fine bruising in the mouth. This, again, could be due to your platelets not functioning as well because of the uremia. Does any of this sound familiar to you? Okay, as you listen to me, are you someone who's been getting bleeding gums or mouth sores and you just haven't gotten all of the answers? If that is the case, then in addition to seeing your dentist, make sure you call your doctor and ask to be evaluated for kidney disease. In me giving you these various warning signs, I'm not trying to scare you. I don't want you to be in panic mode or to freak out. I just want to make sure that you have all of the knowledge tools available to understand what's going on in your body and what's going on in your mouth. Warning sign number 5, bad breath or uremic fever. Now, this is very serious. It's actually not a joke because it is a medical condition. Patients who have advanced kidney disease and uremia oftentimes will have an extremely bad breath. And I'm not talking about like just a morning breath or a breath after you've had some onions and you can brush your teeth and it goes away. No, the uremic fever, the bad breath associated with kidney disease, can smell like fish or like garbage or like urine. It's a severe bad smell to the breath. And here's the key. It does not get better with mouthwash, floss, brushing. All of the dental hygiene in the world does not get rid of uremic fever or the bad breath that's associated with kidney disease. And as you can imagine, this really can be quite socially debilitating. And so if you are listening to me and you have someone in your life who has this kind of severe urine ammonia-like smell, especially if you're also noticing that they have some other signs and symptoms of kidney disease, make sure you have an honest conversation with them and encourage them to see their doctor and to see their kidney doctor. And if you're listening to me and you're doing all of the dental hygiene procedures, but you notice that your breath still smells like fish or like urine, this is quite serious, because by the time people develop a bad breath due to uremia or kidney disease, that means more times than not that the kidney disease is very advanced, very likely CKD stage 5, and patients really might be in a situation where they need urgent dialysis. It's possible, which is why it's so important for patients with this uremic odor to go to their doctors right away. Now, here's the science behind it. This is the connection between kidney disease and the bad breath. When you have uremia, okay, when you have high amounts of urea in the blood and it enters the mouth, well, then your saliva helps to break down that urea with your oral bacteria, and it releases ammonia gas, which is what gives that ammonia or urine-like odor, okay? And so if you go back to warning sign number 1, dry mouth, you will recall that patients with kidney disease and dry mouths tend to have an overproduction of bacteria in the mouth. And so you already have the dry mouth with kidney disease, you have the bacteria, and that high amount of bacteria in the mouth will help you to further break down the urea, which can intensify that foul, fishy, urine, ammonia breath in the mouth. If you are someone who has this bad breath or you have a loved one with this bad breath, remember, there's nothing to be ashamed of. This is medical. What you do want to do is make sure you contact your doctor immediately, because in some cases, a bad breath can be a very serious warning sign of advanced kidney disease. So there you have it. These are 5 warning signs and symptoms of kidney disease that could be hiding in your mouth. And I want you to hear me clearly. Even if you have 1 or 2 of these warning signs, that does not mean that you necessarily have kidney disease. It just means that I want you to pay attention to what's going on in your body and make sure that you know your numbers. Remember, the warning signs are dry mouth, metallic or ammonia taste in the mouth, pale tongue or a coated tongue, mouth sores or gum problems, and a uremic bad breath. If you have these warning signs, I do want you to make sure you know your numbers, know your lab work, consult with your doctor, and make sure you ask for the following tests: BUN, creatinine, EGFR or estimated glomerular filtration rate, and a urinalysis that includes a urine albumin to creatinine ratio. I want you to feel empowered to pay attention to your body, to know your numbers, and to protect your health. If you found this video to be helpful and informative, please be sure to like it and share it with the people you care about. As always, I appreciate you for your support, and I want you to continue doing your best to live your healthiest, happiest life. I'm Dr. Frita.